Hopefully everyone can hear me. Courtney, if not, just chime in and flag me, raise your hand, whatever works. So Courtney, thank you for that introduction. I'm lucky to work with Courtney on a regular basis in the clinical setting. She's a rock star and keeps me on track and efficient in my clinic. So as she stated, Sam and I are going to be giving a youth running update on reducing injury risk and returning stronger. Thank you all for joining us today on this beautiful Saturday morning. Hopefully it's beautiful where you are too. Let's get started. As Courtney mentioned, we have no relevant financial disclosures. So I wanted to start with introducing you to our team. This is the Motion Analysis and Sports Performance Lab team. So as Courtney mentioned, I am a primary care sports medicine physician with residency training in physical medicine and rehab, and then a sports medicine fellowship. I'm the medical director of the Motion Analysis and Sports Performance Lab. I wanted to introduce Celinda Chan. She is our amazing physical therapist. She got her bachelor's at UC Berkeley in nutrition science, as did I, except at University of Nebraska-Lincoln. Then she went on to Master General for Physical Therapy School. She does our physical therapy assessments as part of our motion capture and analyses, does many other things within the lab too. Sam Lyons, who you'll hear from in a little bit. He is our biomechanist, and he received his Master's of Science in Exercise Science at Western Washington University with an emphasis in lower extremity biomechanics. Prior to that, he completed his undergrad at Western Washington as well, and he ran track and field and cross country there. Jeff Morgan, last but not least, he is our athletic trainer and biomechanist who received his Bachelor's of Science and his athletic training certification at Boise State, then received his Master's in Science and Biomechanics at East Carolina University. So I wanted to have Sam chime in quickly and introduce our Motion Analysis and Sports Performance Lab, because he will do a much better job than I will.
Yeah, thanks, Emily. So really quick, we just wanted to touch base on what our lab is. So we're lucky enough to have a nice lab space out in Sunnyvale where we utilize 3D motion capture to get an exact kind of what we call kinematics and kinetics of our patients. So really it allows us to get accurate 3D motion of how our patients are deciding to move. And then when we use what's called force platforms and an instrumented treadmill, we can then get some what's called kinetic data, or just a measure of the forces that are going through their bodies and through their joints to get an accurate idea of how they're deciding to move and then how the world is kind of imparting forces on them. So these are just 2 examples or 3 examples of the skeletal movement of a patient running and then doing some other more dynamic tasks like a deceleration and a drop.
Thank you, Sam. These are live videos, or these were videos taken from our lab. So I wanted to start with a case presentation just to get us on the right track. So a 16-year-old female cross-country runner presents to clinic complaining of pain in her lower leg. I see this a lot, especially right now. The patient stated that she rapidly built up her training and volume due to some COVID-related activity changes. We're experiencing this right now as sports are reopening and athletes are trying to get back into shape and start to race and compete. She reported a change in mileage with an overall increase in hill workouts for the cross-country season, running uphill and running back downhill. She describes a more vague, diffuse shin pain, usually worse those first few steps of her run, but then slowly gets better 5 to 10 minutes in. And she's really unsure of shoe mileage, and she actually brought her shoes in. And as you can see, there are a couple of holes. I can't say I've seen anything this bad, but I do like to have runners bring their shoes in just to take a look at what their shoe mileage is like. And sadly, I think these shoes are ready to retire. So we got x-rays that day just to evaluate for any obvious bone abnormalities. That x-ray was negative. We then got an MRI due to some concerns with the tibia, and found on axial and coronal some cortical thickening, some periosteal reaction, a little bit of reactive bone marrow edema along the anterior medial aspect of the proximal to mid tibia, both in the axial and coronal planes. So the question is, now what? And hopefully today we can answer some of those questions that you may have, starting with reviewing most common running related overuse injuries, describe both intrinsic and extrinsic risk factors for running related injuries in youth runners, review measures to reduce those injuries in youth runners, and then Sam's gonna take it over with discussing current trends in running footwear and some myths and misconceptions around footwear. So I wanted to start off by just discussing some statistics and some epidemiology in youth runners. Running is a common form of physical activity. It's the most common form for girls and second most common form for boys. Sam, I did look this up, and the most common form for boys is basketball. Interestingly, the second most common form of physical activity for girls is walking. Not sure I fully understand that, but that's what it said. So in 2018 and 2019, almost 500,000 high school student athletes participated in cross country, and over 1 million participated in track and field. The absolute numbers of running related injuries are increasing. From 1994 to 2007, the incidence rate increased the presentation into the ER increased by 34%. The highest injury rates occurred in ages 12 to 14. Prospective studies have reported a cumulative seasonal incidence of injuries for female track and field athletes to range from 34 to 52%. And cross-country runners had the first and third in girls and boys rates of bone stress injury per athlete years among US high school athletes. This is something that's, if you're in the medical field, this is presenting to your clinic, it's important to understand some of those risk factors and how they may present and how you can try to help treat and prevent them. So I wanted to break down these running related injuries by just overall anatomical location. A lot of these are in the apophyseal category. Dr. Christy Boyd did a presentation last month on this, so hopefully you were able to tune into her talk. So we see a lot of runners with knee pain. Oftentimes, this could be related to Osgood Schlotter's an apophyseal injury, Cindy and Larson Johansson, patellar tendinosis, or the more broader term of patellofemoral pain syndrome. I bolded the ones that I just, in my clinic, see quite a bit. Moving down to similar to what the case study presented was more of that exertional leg pain, which is also a more broad term, as well as the more severe tibial bone stress injury. Moving to the anterior hip, we see apophysitis of the anterior superior iliac spine. Oftentimes we see this more in the track and field athlete, maybe a sprinter. Hip flexor tendinitis, tendinosis, femoral neck bone stress injuries. Those are definitely more concerning, and do think of kind of bigger concerns as far as overall bone health when those present to our clinic. Moving to the posterior hip, another apophysitis of the ischial tuberosity can be seen, hamstring tendinitis, tendinosis in a little bit later ages, and then greater trochanteric pain syndrome of the lateral hip. We also see, and it's again a more general term. And then the apophysitis of the calcaneus, Seaver's apophysitis, more in the younger age group of adolescents. Plantar fasciitis, see a little less common, but I have seen it, especially in those first couple of days or first couple of weeks of a season. Achilles tendinitis, and then metatarsal bone stress injuries. So unfortunately, I can't talk about all these injuries today, but I did want to touch briefly on exertional leg pain. Because of this broad differential, the incidence really varies in the literature. A study on 2,000 runners found an incidence of 12.8%. Another study found that 82% of cross-country runners had a history of exertional leg pain. You can see the breakdown can be musculoskeletal, muscle, bone, tendon, neurologic in origin, or even vascular. Popliteal artery entrapment syndrome, of course, is a little bit more of a rare presentation, but there are certain things in your physical exam that can lead you towards or against, towards or away some of these potential etiologies. So on my physical exam, my first approach is just to do a good inspection, look for any leg length inequalities. I'd like to watch my athlete walk if they're not in too much pain. Sometimes if you have the space to have them stride out in the hallway and can do it safely, recommend doing that. Looking at their overall standing posture, looking at their feet, if there's any significant pes planus or cavus, so kind of high arches, or flat foot or high arches, And then even if there are any fascial defects, kind of looking, I have seen with those kind of more of that chronic exertional compartment syndrome presentation, I have seen an athlete that actually has a kind of a slight herniation or fascial defect in part of that, that tissue, which is really interesting. And then, of course, thinking about palpation, any tenderness along that tibia. If it's more diffuse, you're thinking more of that medial tibial stress syndrome. If it's more localized, potentially more of that kind of higher grade bone stress injury or stress reaction, stress fracture. I also kind of feel and see if there's any tightness in certain musculature at different lower leg compartments. A good neurologic exam, a good vascular exam is important. And then special tests like a hop test and then navicular drop, which you can see here measures that difference between the lower border of the loaded and unloaded navicular bone. There's really no specificity or sensitivity data on this, but it can kind of lead you if there's significant amount of navicular drop that may predispose or kind of raise your concern for a medial tibial stress syndrome. So medial tibial stress syndrome, often referred to as shin splints historically. The incidence of this also is pretty broad, ranging from 4 to 35% in athletes and military personnel. Usually patients describe, or athletes describe, pain of that posterior medial tibial border, usually spanning a kind of wider span of 5 centimeters. There are multiple different theories out there as far as what causes medial tibial stress syndrome. Traction theory, where some of the muscles in the posterior compartment may be kind of creating a traction mechanism along the tibia, leading to periostitis or inflammation of the periosteum. Different pathologic adaptations can take place with tibial bending and bowing, leading to these adaptations within the tibial cortex. And then there's also a question of whether lower tibial bone mineral density predisposes an athlete to greater risk of medial tibial stress syndrome. Different imaging modalities can be performed. X-ray is usually unrevealing. Bone scans have a lot of radiation exposure and usually lead to high false positive rates. If I'm concerned about a bone stress injury or more severe stress fracture, then I'm going to get the MRI. And you can see the breakdown as far as MRI based on severity. It can be helpful for an athlete because that duration of rest can really make a difference between maybe part of a season in a lower grade bone stress injury or kind of medial tibial stress syndrome, and a higher grade kind of stress fracture where there's an actual fracture line. I think it's important to also just point out that for me, I see medial tibial stress syndrome along the spectrum of bone stress injuries. And so for me, it's not something that I kind of categorize in different ways. It's kind of still related to the bone. Treatment is conservative with relative rest or absolute rest, depending on the severity. There are different types of cross-training modalities that an athlete may be able to do to maintain some fitness. Questionable whether shockwave, a lot more research is needed for that. And then especially in our clinic, we do gait retraining as part of a potential management in certain athletes. So oftentimes when I see an athlete, depending on kind of how complex the athlete is, I will recommend a running assessment once they are safely running again. Sam Lyons just submitted an abstract to American Society of Biomechanics last week on altered joint powers. So kind of the joint involvement during running after tibial bone stress injury. I am going to kind of avoid pulling Sam in to do a full breakdown of that, because it does get into a little bit more technical that we won't be able to fully dive into today. But hopefully he gets that podium presentation in a month or two and can share more then. So I wanted to switch gears and move forward to risk factors for youth running related injuries. I was fortunate enough to be part of this youth running consensus statement that just came out in BJSM in 2021. It is open access, so I recommend this breaks down and pulls in a lot of what I discuss and kind of goes into more detail about that. This is a group of experts, physicians, physical therapists, dietitians, athletic trainers, all kind of coming together and kind of looking at the research on intrinsic and extrinsic risk factors. So each statement was graded using the strength of recommendations taxonomy sort. So I just wanted to give you an idea of what the grades A, B, and C really mean, and kind of give you an idea of kind of the quality of evidence that's out there or not out there. So wanted to start with intrinsic risk factors. So most studies, both retrospectively and prospectively, demonstrate that females are at higher risk of running related injuries. both in the high school and middle school aged runners running population. A lot of my research is on better understanding risk factors for injury in female athletes, especially bone stress injuries. So this really reinforces that effort, and the evidence or the quality of the evidence is quite high showing this. So switching into the growth and development discussion. So adolescence is this time of rapid growth and development with peak height velocity defined as the rate of growth usually occurs around the age 12 in females and age 14 for boys. Interestingly, bone mineral content is lowest just prior to this peak in height velocity. So it just reinforces that how important this time is for peak bone building. We'll get into a little bit more about some bone health conditions and things to be thinking about as far as factors that can contribute to that bone health growth and development. By age 20 years, young adults have more than 90% of their peak bone mass. There is no consistent data addressing either age or developmental stage as a risk factor for injury among youth runners. However, though this evidence is lacking, I still kind of feel anecdotally that these youth runners may be at increased risk for injury during these periods of biologic change or peak height velocity. If an athlete is kind of coming into your clinic during those that annual physical and they've had a rapid growth spurt, it might be valuable to discuss kind of modulating training to avoid any kind of rapid increases in volume or intensity, maybe recommending a little bit more of kind of building that strength and foundation a bit more before kind of diving into a training block. Moving on to body mass index, a study of 105 cross-country runners aged 13 to 18 found runners with a higher BMI of 20.2 to 21.6 were 7.3 times more likely to experience medial tibial stress syndrome than runners with a lower BMI. Interestingly, a prospective study of over 700 high school runners aged 13 to 18 found girls with a BMI less than 19 had nearly 3 times greater risk for bone stress injury than those with a higher BMI greater than 19. So the question is, are these athletes that are potentially overtraining, underfueling in that lower BMI range, kind of pushing past that kind of medial tibial stress syndrome into those higher grade bone stress injuries? It's hard to really glean because from these two different studies, but I still think it's important to be thinking and looking at BMI, thinking about BMI percentile also as part of a potential risk factor, especially I've even seen in the last 5-6 months changes in BMI and drops in weight with athletes that maybe are training more or running more because that's all that they have access to during the pandemic, since gyms are closed and a lot of organized sports have been off the map for a while, or off the grid. So looking at alignment and strength, a study of almost 400 high school cross-country runners aged 14 to 18 looked at the association of an increased Q angle and leg length inequalities with in-season injury. They found that a runner with a Q angle of greater than 20 degrees had increased running injury compared to those less than 20. They also found that male runners with leg length inequalities of greater than 1.5 centimeters had also greater injury risk. And other studies have found relationships between muscle weakness and injury risk, specifically hip abductors, knee extensors, and knee flexors. I did just want to show you what a Q angle is. So that's a measurement from the anterior superior iliac spine to the patella to the tibial tubercle. I don't often measure Q angle in my clinic with the goniometer, but I do kind of look at overall alignment. I would rather kind of look at an athlete and do a more dynamic test, like a single leg squat, see how much leg length or valgus and kind of imbalances, and kind of just that type of assessment is a little bit more dynamic and helpful for me. And that's going to assess more of that those muscle imbalances, like those hip abductors, those knee flexors, like the quads, and the knee flexors, like the hamstrings, and the knee extensors, like the quads. I think more importantly is the discussion on exercise-based programs. There have been some studies that have shown that elements with high intensity neuromuscular training, jumping and plyometrics, balance training may help reduce injury risk in youth runners. Unfortunately, the evidence is low, mainly because we just need more studies. It's harder to study and control. You think about like a collegiate athlete setting or professional athlete setting where they've got a gym, they've got their trainer, they've got their strength and conditioning coach. It's a little bit easier to control those variables. In a younger athlete population, it's just harder to make get all of that information in a well-designed study. But we still do find it important, and I'll touch on that a little bit more in a bit. Switching gears to the intrinsic risk factors of bone stress injury, an important area of my kind of research and clinical interest. There is limited evidence to support primary amenorrhea or irregular periods, or no periods, excuse me, before the age of 15, a BMI less than 19, and prior participation in gymnastics or dance as fracture risk for, and prior fracture as risk factors for bone stress injury in female adolescent runners. I find it interesting. You might think, well, isn't gymnastics or dance potentially kind of good for bones because of that high impact activity? Unfortunately, a lot of those gymnasts and dancers are in that kind of low energy availability and are under fueling, and that's kind of predisposing them to potentially higher risk of kind of the female athlete triad, which is, I'll go into that definition now. So the female athlete triad was originally described in 1993. There are multiple position statements that have come out in 97, 2007, and most recently in 2014. The triad is defined as the interrelationship between menstrual dysfunction, so irregular periods, low bone mineral density, and low energy availability with or without disordered eating. This is presented on a spectrum because an athlete may present kind of in these earlier stages. And of course, we would love to catch them more in that kind of green, blue area than in that red, more severe presentation. More research has demonstrated a similar phenomena in males, except instead of irregular periods, males have other reproductive suppression, including suppressed testosterone, abnormal sperm, and other hormones that are suppressed or increased, such as an increase in overall cortisol. In 2014, the International Olympic Committee put out a consensus statement on relative energy deficiency in sport. The major difference between Triad and Red S is that the Triad largely focuses on that irregular period bone mineral density from low energy availability, whereas Red S expands further on the many negative physiological and performance consequences of low energy availability, as you can see here. Overall, these are both important concepts to understand and to really discuss. A lot of these graphics can be helpful just to explain to an athlete who may not present with an irregular period, especially in a male athlete. They may present with fatigue or these other symptoms that are a little bit harder to describe and pinpoint, but that could be from that low energy availability, and asking about fueling and nutrition is a really important part of that assessment. Looking at bone stress injury in males, there's limited evidence to support prior fracture as a risk factor for bone stress injury in male adolescent runners, and participation in basketball may reduce risk for bone stress injury. I'll get into that a little bit more about sport diversification. Looking specifically at bone mineral density, limited evidence in females supports menstrual dysfunction, again, low BMI, prior fracture, and a longer participation in endurance running as risk factors for low BMD. And then for males, there's limited evidence to support low BMI, prior bone stress injury, low dairy intake, and a belief that being thinner leads to faster running performances as a risk factor for low BMD in males. I think it's really important to, I appreciate that this study looked at these types of questions about body image and this belief that being thinner is runner. I think there is some issues in the culture of running and what a typical runner looks like, especially in a developing adolescent runner. I feel like social media is full of some images and kind of these pictures and depictions of what a runner should look like. And that can lead to these maladaptive behaviors and thoughts and patterns that can really affect an athlete's just overall their ability to really thrive in their sport and go through some important developmental milestones. So switching gears a little bit and talking about extrinsic risk factors, starting with training. It was a prospective study on a smaller group, 68 high school cross-country runners during season. And they found that that runners with a lower step rate of below 164 steps per minute were almost 7 times more likely to incur a shin injury. So step rate, you may also hear cadence used a lot. So that's the number of steps per minute. In our clinic and with our running evals, oftentimes we do talk about step rate. Oftentimes we don't make drastic changes in step rate, but sometimes if an athlete comes in with low cadence and tibial pain or history of medial tibial stress syndrome, we can talk about in conjunction with a lot of other interventions or recommendations, changing that cadence slightly. Studies also have shown that training less than 8 weeks during the summer can increase risk for injury. Single terrain training, so on one specific surface, running only on track, only uphill, only on concrete, could potentially lead to injury risk. And I will say that overtraining is not recommended too, but I think that what the takeaway here is kind of building that foundation before really rapidly increasing the intensity or the workouts for an athlete during season. And then also training intensity. So kind of making sure that an athlete isn't just running fast all the time. Those recovery days are really important. Making sure those easy days are easy. Sometimes an athlete, especially who's just naturally kind of falls into a certain pace, just runs that pace all the time. And we really think that diversifying the pace and the terrain is really valuable for just kind of maintaining good balance and reducing that overall injury risk. So looking next to some other extrinsic risk factors, such as biomechanics. Foot strike is a hotly debated topic in the running biomechanics world, as Sam can attest to. You can see a rear foot strike pattern and then more of a forefoot strike pattern. We see runners with all sorts of foot strike patterns, and most often we don't recommend they change their foot strike. Very rarely do we talk about it. The research doesn't really support changing foot strike in adolescent runners. There does need to be more research, but really no reports available to assess if foot strike mechanics or specific interventions to change foot strike mechanics alter the risk of injury in youth runners. And I'm going to leave it at that because Sam could probably talk a whole hour on this. Reducing injury risk as far as timing. In the adolescent running world, there really is no set distance recommendations based on certain age. There are a lot of kind of opinions and expert advice on this. There's no really research that shows a certain age is bad for running. And I know that can be pretty hotly debated as well. This is really highly individualized. I did want to just discuss briefly this organization called Students Run LA. It's a school-based 7-month marathon training program that prepares socioeconomically at-risk kids aged 12 to 18 to run the LA Marathon. I've run the LA Marathon. It's not an easy marathon to run. So I'm very impressed with this. Through 2018, more than 66,000 middle school and high school students have completed the marathon with no reports of serious injury or death. Over 2 years, 2016 to 2017 and 2017 to 2018, they did a study that indicated that 20% of runners reported pain at some point during the program, mostly involving the knee, foot, and ankle. However, the 99% of the participants who started on race day completed the marathon without serious injury. And also, which I found really neat, was participants who completed the program were more likely to make healthier food choices, exercise on a regular basis, graduate high school, and go on to college. So really kind of the takeaway, my recommendation is, although no set age recommendations, an athlete should be physically prepared to run, so injury-free, and mentally prepared. So intrinsically motivated, it's their choice to run, and without external pressures from parents, coaches, or someone else. It does bring in this question about early sport specialization, what age is appropriate to kind of specialize in that one sport versus continue to diversify. And one study did look at high school female distance runners and found that higher sport specialization was associated with an increased likelihood of low bone mineral density. Which raises the question about sports diversification. So what about other sports? Participating in multi-directional movement patterns and unaccustomed lows can have an osteogenic effect. So things like soccer, basketball, with a lot of cutting and pivoting. Dr. Michael Fredrickson, who one of our colleagues at Stanford, found that prior participation in ball sports led to a 50% reduction in developing a bone stress injury in both males and females. However, females with irregular periods did not see these same benefits from ball sports, kind of going back to some of those other consensus statements on irregular periods as a risk factor for bone stress injury and low bone mineral density in females. So I wanted to speak very briefly, far too briefly, on the importance of strength training, especially even in the adolescent athlete. So in our lab, we do recommend resistance exercise as part and kind of as a complement to a running program. I feel like that's, as a runner myself and working with a lot of runners, we're not doing enough heavy lifting, and it's something that we're trying to encourage more and get more research out there on. Things also that are important are things like jumping and plyometrics, neuromuscular training. I do want to reference two important articles out there, position statements and policy statements on strength training by children and adolescents, and a youth resistance training consensus statement, just to kind of look at the stance and the position that resistance exercise is a safe to do. Oftentimes there does need to be some good guided recommendations on the types of exercises and where to start. That doesn't mean that they shouldn't be doing it. Also, things that we encourage are drills and strides and a dynamic warm-up over static stretching. And a quick shout out to Derek Miles, who was a physical therapist in our Sunnyvale clinic for many years. He wrote a great article on resistance training for youth that can be found online at Barbell Medicine. I really like all these different factors contributing to athletic development. Some need to be emphasized maybe a little bit more, a little bit less, depending on an athlete's age and development, but all of them are important to some degree. So kind of looking at just overall reducing injury risk as far as training, some important takeaways just as far as sports specialization. We recommend at least one full rest day per week, sometimes more depending on the athlete and depending on kind of where they are in their training and at that age. Limiting participation to less than 9 months per year, delaying specialization, ideally after puberty, to allow for those to go through those developmental milestones. Moving on to just reducing injury risk through nutrition. I could probably spend a whole hour on this. The importance, a lot of youth runners are not meeting energy needs. Youth runners of both sexes require adequate energy availability to provide optimal sports performance and support growth. This means just kind of overall caloric intake, but also certain micronutrients like calcium, vitamin D, and iron. We did a pilot study on looking at the female athlete triad and iron supplementation among high school distance runners. And we actually were trying to see if there was evidence of iron deficiency in high school distance runners, but so many of those athletes were already supplementing with iron that we actually found that the higher triad risk factors were associated with more iron supplementation, which makes me question, are they blindly supplementing when they're not getting enough overall caloric intake? We also found that 76% of those athletes had disordered eating or eating disorder behaviors, which is of concern. I get a lot of questions in my clinic about hormonal replacement. A lot of athletes talk about missing their periods. And so I created this infographic last summer to kind of help explain some of these things. One of the questions I get or I hear a lot is most of my teammates lose their period during the track and cross country season, so it must be normal. Some athletes think that this is a rite of passage, that they're not training hard enough until they lose their period. Unfortunately, a lost period during heavy training is likely a sign of something else being off, such as low energy availability, under training, overfueling, even changes to cycle. Maybe their cycle is lighter. So those are all things that should be talked about, ideally at the beginning of a season with these runners, female runners. Also, an athlete who loses their period during track and cross country season and the doctor puts them on the pill for that reason alone, I think that that's likely premature, and really further assessment or questions need to be done before doing any type of hormonal replacement. The fine print is sometimes there can be a time and a place for certain types of hormonal replacement, but usually we recommend waiting at least 6 months to a year of nutritional intervention and exploring other potential causes prior to doing that. Lastly, and this is something that I use in my clinic to kind of help stratify an athlete as far as their degree of risk. We have found that higher triad risk factors in collegiate athletes are associated with greater risk of prospective bone stress injury, both in males and females. We can break this down into cumulative risk scores. That was from the Female Athlete Triad Coalition Consensus Statement of 2014. Relative energy deficiency in sport also has a cumulative assessment tool that's quite helpful, breaking an athlete down into high, moderate, and low risk with a return to play model kind of based on that risk. It's helpful to not understand what tools are out there and what tools are appropriate for your practice and what you're doing on a regular basis. Lastly, kind of going back to that biomechanics, and I'm using exploring biomechanics as a reduction in injury risk. These are things that we look at in our running analyses, looking at foot and rear foot pronation. Sam will get into this a little bit more during his section. And these are this is a common malalignment that we see in our runners. A lot of this can be changed with just really good strength training. And then this is just another look at one of our running analyses. We also look at vertical loading rates as part of our running assessment. And that's also a hotly debated topic in the running biomechanics world. So I'm going to hand things off to Sam, talk about footwear. Again, this is taken from the sub 2 hour, when they tried to break 2 hours in the marathon. You can see all of them were running in the Nike Vapor, oh my gosh, what am I, Sam?
Vaporfly, Next%,
yeah,
Alphafly, one of those.
Yeah. So is it in the shoe, Sam? That's the question. So I'm gonna hand it over to you, stop my sharing, and thank you for your time. And I'll kind of also scan for questions, so prepare for that.
Okay, so I'll go ahead and take over the screen share here. Just give me 1 second. Okay. Emily, again, thank you for your talk. So like I said, I just kind of want to go through some specifics around footwear. I know in clinic, we get a lot of questions about footwear, and there's just so much ambiguity involved. That's because people come in, and even runners still believe that one of the greatest perceived extrinsic risk factors is what kind of footwear they're wearing when they're going on their runs. So they still believe that wearing the wrong shoe for their foot type can really cause them a lot of issues. And meaning the wrong shoe, they believe that the shoe is not letting them go through a certain range of motion, or that they're over-pronating, or that they have too high of what's called vertical loading rates. Now, just as a review, in the bottom right of the screen is just an example of pronation. Now, keep in mind, it's a triplanar motion of the foot and ankle complex that ends up putting a lot of strain on the medial aspects of the foot and ankle. And, you know, in theory, can also put some strain on different parts of the knee, as well as higher in the kinetic chain. So shoe design is kind of developed to really control those two variables, controlling overpronation and controlling loading rates. And the way it's done this is by adding support into the midsole, as well as adding some cushion. And that's kind of developed really what the common way of categorizing footwear is now today. So really, when you break it down, you have three main types of shoes, and the motion control or the maximal shoes. And then you go down into the high stability, just kind of stability-esque shoes, where there's different levels of stability. And then all the way at the other end of the spectrum, you have neutral shoes. Now, minimal shoes are a very popular-esque type thing. They've been kind of popular for the past 10, 15 years or so. And I'm not going to spend too much time on those. Really, I want to kind of focus on the three options up above, where a motion control shoe is designed to have a really high stack height, so a really thick sole here. And then also the structure in the shoe is really rigid. So it's not very stiff, or excuse me, it's very stiff and doesn't allow for a lot of movement. And as you kind of go down into stability, you get a little bit more, you allow for a little bit more motion in the foot. The stack height gets a little bit smaller, and then all the way over to a neutral shoe where the stack height kind of stays the same, but really the design of the internal structures of the shoe is to let the foot do whatever it wants to do. And really, whatever option you pick, the hope is that we can manipulate your foot pressure patterns, or your gait line, if you would, to be quote unquote neutral. So if we look at the bottom left screen, these are two examples of foot pressure data taken from our lab and our instrumented treadmill. So the graphic on the left represents a gait line where you can kind of see at the bottom of this gait line where somebody's making contact with the ground in the lateral rear foot. And as they move through mid stance, we get that sharp medial aspect of the gait line which is representation of a lot of pronation in the foot. So the theory is to change their shoe so that they get to the image to the right, where we have a nice, straight, neutral gait line. But there's a couple problems with this. When we actually look at the data, the way that shoes do this is a little controversial. So what has been found previously is that the way shoe structures work internally is just non-systematic. So let's say, for example, we have a person with a foot pressure pattern that looks like this image here to the left, and they have a gait line that looks like this solid red line. So if we wanted to make their gait line a little bit more neutral and put them into a stability shoe, we very well might get a profile that ends up looking something like this, where it straightens out and we get a nice little straight line. But at the same time, we could have another person with the exact same foot pressure, the exact same gait line, and if we make the exact same recommendation, there's very much so a chance that this person might end up with a gait line that looks like this, where they're deciding to pronate a little bit more. It's really just because prescription of these shoes is really non-systematic to how it ends up affecting the individual's foot strike. But even to kind of build on that a little bit further, when we really look at the data of pronation leading to injury, we also kind of get a little bit of ambiguity there. In a study of about 1,800 runners that have been categorized by highly supinated, supinated, neutral, pronated, and highly pronated, the group of pronated individuals actually had significantly less injuries than all the other categories combined. But the highly pronated group kind of had the most injuries. So kind of deciding to categorize people based on pronated versus highly pronated is a little bit challenging in itself in deciding what person goes where. So rather, I kind of like to stick to a couple other things that we know specifically on footwear. So first and foremost, when we look at plantar shape of the individual shoes, we know that plantar shape has little to no significance with describing whether or not a runner is going to be predisposed to injury. And for those of you that are curious, plantar shape, the plantar surface of the shoe is represented by this yellow line over here, but it really refers to the actual structure of the inside of the shoe. Additionally, midsole cushioning also has a little to no effect on whether or not a runner is going to kind of be predisposed to injury. And midsole cushioning really refers to stack height, how squishy the stack height is, how big it is, so on and so forth. But what we do know is that when we do take runners and put them into a neutral shoe versus a minimal shoe, by the books, this is going to set them up a little bit better to reduce their risk of injury. Specifically, this study compared Nike Freeze, one of the most popular shoes for young athletes, and compared them to Nike Pegasus. A neutral option, same brand, anecdotally looks very similar and should be just as popular. It's a much better shoe as it's designed for running. So keeping them out of that minimalist option is probably going to set them up for a little bit more success. But really the most important factor that we know from the research is that the quality of comfort of the shoe or orthotic is really the most important factor for deciding on what to do with your footwear. Whether it's picking a shoe or adding in an orthotic, the number one priority should be adding comfort, perceived comfort of the individual first and foremost. So if somebody does want to change their shoes because they have an option that's uncomfortable and they want to shift to something that's a little bit more comfortable, we have to keep in mind that certain changes will occur when we do decide to change footwear. So these changes are largely acute, so they'll largely dissipate with time and with training, but it's important to keep in mind that different tissues are going to be stressed. So when we want to move to decreased stability, so going from, for example, motion control shoe down to a stability shoe or stability shoe down to a neutral shoe, we got to keep in mind this might promote a little bit more anterior of a foot strike where they get a little bit farther on their mid to forefoot, and this is really going to increase the demand of their ankle joints. So their ankles are going to get a little bit more tired during the run. Same thing on the other side of the coin. If we want to go backwards, if they're in a neutral shoe and we want to go to stability, in a stability shoe, we want to go to a motion control. This is going to increase involvement of their specific knee joint. So it's something, again, important to keep in mind. So I wanted to give you guys specific examples on some things to look for and how they're categorized in the industry. So to the left, we have a couple examples of some motion control and some high stability shoes. And then in the middle column, we have some very generic stability to neutral shoes. And over to the right, we have some really neutral to minimal options. And this is how these might be categorized. And I won't go into each one of these specifically, but these are all some just generic options. But I would challenge us to look at these shoes a little bit differently. So the way that it might be easier to think about these is to plot these shoes based on what we call stack height and stiffness. So how much bending stiffness is in the shoe, and then how big the midsole is itself. And when we plot a bunch of these options, we kind of get this mess of shoes that end up all over the place, where we have these really overlapping kind of qualities between stability and neutral, and even minimal for that matter. But we can kind of see that in this top right quadrant, a lot of the shoes kind of get knocked all together. But we can still kind of break these down into specific categories. So if we kind of group these over here, the blue circle represents kind of your high stability motion control. The green represents your high to mid stability. The yellow and the red represent your mid stability to neutral options. And then the black represents your kind of neutral to minimalist options. So this is how I would consider is a little bit easier way to look at these shoes, so that if we kind of then go back to our list here, we can kind of break them up the same way. So let's say we have a runner that comes into our clinic and you just ask them very simply, how do you like your shoes? And you look at their shoes, they have a really high stack height and they're really rigid, and they say, I don't like them. They're kind of uncomfortable. They give my feet they cause my feet a little bit of pain. I don't like running in them. Well, then we could decide to either keep them in the same kind of style, and you could recommend something in this blue or green option, or we could shift them down very minimally because we know too big of changes will cause acute adaptations. So we can try to keep them in the green or the yellow box. On the other side, if somebody is in a minimalist shoe and they have the same response, my foot doesn't feel good, I'm uncomfortable in my shoes, you can kind of shift them over very slightly, again, back to this midline of the red to yellow box. Again, and then if you have young athletes who are coming into your clinic and are just looking for a generic recommendation, all of these are great starting options where people can have a lot of success and feel great in their shoes. But I think a great place to start would be these yellow and this red kind of box options. And there's a ton of different variety of these shoes, but these are just really generic good starting points. So my main takeaways for footwear that I want to leave you guys with are really just three kind of main points. First and foremost, that shoe prescription is just non-systematic. So we should kind of avoid using terms of wrong shoe or incorrect shoe, because any kind of shoe can really work for an individual depending on how they're training, depending on how well they're staying healthy, and the fact that changing shoes is going to affect people very differently. Now, when we do change shoes, because inevitably shoes will change and people might want to change their shoes just in general, we have to keep in mind that when they ask questions about it, we keep them in the loop that adaptations can occur. So really, when you look at really big changes, we know that these acute adaptations can be maladaptive. So we want to make really small changes between shoe types. And lastly, and most importantly, is that when people ask what the best recommendation for footwear should be, really, it's hard to give a really big recommendation. The best thing to say is to pick a shoe based on comfort first. If runners find an option that is the most comfortable, it's going to set them up for the most success. That being said, that's the last thing I want to leave you with. So, Emily, if you have any closing remarks, we can move on to some Q&A.
Yeah, I think maybe for the sake of time, we can just dive into Q&A. Sam, thank you for kind of dispelling some of the myths around, like, is it in the shoe? And I think, yeah, it's all about comfort, but there are some kind of basic guidelines that an athlete can follow. And if you have several holes in your shoes, obviously we would love to recommend rotating through to a new pair. But Courtney, did you want to kind of guide through the Q&A, or do you want me to start from the top? Because there are a couple of questions directed towards Sam, and let's just see if we can kind of go to the start about this trend in barefoot running. Sam, do you want to touch on that briefly? I know we could probably talk about the shoe name slide. They want you to pull up that shoe name slide, so maybe you can.
Oh yeah, sure, absolutely. I'll pull that up really quick.
And then real quick, whoever asked about the accreditation, you'll get an email after that this week from Stanford CME to fill out a course evaluation. And then once the course evaluation is completed, then you'll get your CEU credits.
So yeah, I'll answer really briefly on the comments about barefoot running. Again, I don't want to dive too much into it. It is barefoot and minimalist running is a really hot topic, especially even in the biomechanics world. You know, the trend started with with a big paper that came from this researcher out at Harvard who is a biological anthropologist that said humans, didn't really evolve to be wearing shoes. And that's when the fad kind of took off. And people can have a ton of success wearing minimalist and barefoot footwear as long as you do your due diligence in training your feet and your ankles and getting everything really strong. But it is a rough transition, so be careful kind of transitioning to a rear or a forefoot strike, and just be really conscious that it's going to be taxing on your calves just in general. So it takes a while to get up there. If you have any specific questions about it, I don't want to just kind of go on my spiel because we'll be here all day. But I'm happy to answer any specific questions about barefoot footwear if you have something specific in mind.
Sam, I want to ask about this, like what shoe type is best to prevent ankle rolling in runners, and like a specific shoe type for like chronic knee pain or waist problem, or kind of low back issues. But I think starting with like the shoe wear, maybe like my thought process is it's more than just like shoe support. I don't think I would recommend a more minimalist shoe for a new runner, especially a runner that's running on terrain, especially a cross country course, because of that mixed terrain and variability of terrain. However, I also think that encouraging other types of kind of strengthening exercises to help build up that foot and ankle strength. So even just doing plyometrics and kind of multi-directional hopping tasks can be even more valuable, and it's going to strengthen the foot and the ankle and the muscles around the foot and ankle as opposed to trying to have a shoe do that job.
Yeah, I completely agree. I think, just getting your ankles a little bit stronger just sets the athlete up for a little bit better for success, especially in the pediatric population. But there is a little bit of research looking at, flares of footwear and, transverse stiffness of the shoe. If you take your shoe as an example right here and bend it this way, shoes that are stiffer in that kind of a plane are going to end up predisposing runners to have a little bit more of a twist when they hit some uneven surfaces. So trying to stick to something a little bit more neutral might allow a little bit more bend in the shoe and kind of help that kind of foot landing go through a better range of motion. But again, I think the more important piece is just what Emily said, keeping the foot and ankle really strong through just proper training is a little bit better.
Let's see. Trying to look with sports resuming for kids. It's safe to do both at the same. Club and high school sports simultaneously. I'm not a big fan of dual club and high school sport participation at the same time. I have athletes and runners who are doing both club running on their club team and the kind of track and field or cross country team. And if they're not doubling, I don't want them to do double runs, but if they feel like they can get and they have a good agreement with their high school or school coach, and they can do that club, and it's legal by whatever that county regulation and county guideline is, and they can get some good workouts or maybe the quality workouts from their club team, great. But they shouldn't be doubling up in volume, and I think that it just runs that really high risk of overtraining and increasing that risk of overuse injury. I'm a big advocate for optimizing those recovery days, those rest days. Athletes, high school runners should not be running 7 days a week, ideally 5 to 6. And some athletes may run 5 days and then have that 6th day be a cross training day on the bike or swimming. There's also a question I was typing out about X-ray being low yield. I agree, oftentimes it isn't revealing. Sometimes we need the X-ray for MRI authorization, which is a really bad excuse or a bad reason to order anything. But another reason is sometimes it can rule out other kind of like a malignancy or some kind of more rare concerning issue or condition or bone condition. And we can see that really clearly on the X-ray.
It looks like there's been a couple questions on Hokas and some specific shoes. So you're right, there are no Hokas on this last page. There are a little bit on the graph. I tried not to make specific starting options for Hokas. Personally, I think Hokas are a great shoe. I think they can, have a lot of success. But I know that their specific design has changed quite a bit over the past just 3 to 4 years. So I try not to make specific recommendations about that just about Hoka's for you guys, because I think there's plenty of really great starting options here. That being said, if any athlete wants to wear Hoka's, great, I'm all about it. They'll have great success. Same thing with the On Clouds. I think they're an awesome shoe. I don't really know how much of the science is there with the bottoms of their shoes and their kind of thoughts on the sole. But again, a lot of people have tons of success and they're super popular. So really, if somebody were to come into my clinic and say, like, this is my shoe and I love it and super comfortable, great, I'm all for it.
And Sam, I think, yeah, you raised just a really good point about, I think historically there have been like kind of these religions as far as like overpronation, stability, motion control, neutral. And I think we're trying to kind of move away from that to some degree because the running shoes have evolved so much. And I think that there are a lot of these, there is a time and a place, and a lot of athletes can run safely in these shoes. I think what Sam had mentioned on as far as making drastic changes in shoe wear isn't recommended because of the potential kind of adaptations that the foot and ankle need to do. But I also think that younger athletes may need to, they may not be as in tune with their body. So thinking about kind of having that discussion or having kind of working with a professional on kind of navigating some of those questions. And we're always happy to answer some of those in our clinic, but we give a pretty neutral response.
For the sake of time, guys, let's do 2 more questions.
Okay.
I think also this question as far as the initial workup for the lab, that might be something good to touch on as well. I'm assuming that's what this individual is asking about.
Which, can you ask me?
It says, what is the cost of initial workup and how much is the person expected to pay?
That's a great question. So oftentimes, if I have an athlete who comes in who I think has a previous injury, I will refer to our motion analysis sports performance lab. And then it goes through an insurance authorization process to get an idea of how much is covered. There are out-of-pocket costs that can be discussed, and it's something that I think Sam and I are kind of working through as far as kind of what is that price point. Based on how we do our motion analysis, we do a 3D motion capture, a physical therapy evaluation, which is about an hour, I believe. Is that right, Sam, or give or take? As well as kind of reviewing that video, a lot of good takeaways, and a visit by me to kind of review all other kind of injury risk factors, nutrition, and so that's something that if you call our lab, you can get a number or kind of a price point on. And I don't have our phone number, but maybe Courtney can like put it in the chat box too. I realized we didn't have that as far as resources for people. And also resources for ankle strengthening. I think that there are a lot out there. I don't have anything we do have some handouts on that we provide to our athletes. I think anything with like single and multi-directional jumping tasks is really good and helpful. There are some skills and drills that you can look at online, like A skips and B skips, that kind of help with some of that kind of just kind of dynamic movement patterns, as well as looking up dynamic warm-up online.